Assalamu alaikum and welcome to you all in my today's lecture. I am Dr. Abdur Rahman Rana, Assistant Professor, Department of Pharmacology and Therapeutics at the Akij Medical College, Boyra, Khulna. My today's topic is prodrug. In product topics, I want to discuss about what is prodrug and some examples of prodrug, history behind the concept of prodrug, what are the types of prodrug, and what are the clinical significance of prodrug. At first, what is prodrug? Prodrug means there are some chemical substances which do not produce any pharmacological effect until they are chemically altered within the body. Prodrugs are readily absorbed, distributed, and then converted into the active drug within the body. Nowadays, about all marketed drugs, there are about 10% of the drugs are included in prodrug list. In last 10 years, there are about 30 drugs are included in the product list by Food and Drug Administration Authority. Examples of products are enalapril is an product that is converted to enalapril, that active drug. Levodopa is an product that is converted to dopamine. Sulindac is an product that is converted to sulindac sulfide. Metronidazole is an product that is converted to hydroxymetronidazole. Talampicillin is an product that is converted to ampicillin is an active drug. Acyclovir is an product that is converted to acyclovir triphosphate, and zidovudin is an product that is converted to zidovudin triphosphate. Now, what are the history behind the concept of prodrug? Historically, since long, some herbal extracts are used in medicine that contains glycoside, and then by the hydrolase enzyme it converted to more active drug and more bioavailable compound. By this concept, salicin is a drug which contains beta D glucopyranose that cleaved by storage enzyme in the intestine and produce salicylic acid. Aspirin is an acetyl salicylate that is produced by Felix Hoffmann in 1897, and it is the prodrug of salicylic acid. It gets some information about prodrug. Then in the early 19th century, in 1909, another scientist, Shahachiro Haidt, discovered that the first synthetic antibiotic, asphenamine is a synthetic antibiotic, observed that asphenamine is until non-toxic when is chemically altered within the body. When is chemically altered within the body, it produces antibacterial effect. Then 1932, another scientist, Gerhard Bompak, observed that red dye pontosil is found to be effective. It is due in vivo, not in vitro. It is due to red dye pontosil is converted to sulfanilamide, the first sulfonamide. It shows antibacterial effect because it inhibits the folic acid synthesis and produce growth and inhibitory effect of the bacteria. Now, what are the types of prodrug? There are major two types of prodrug. This is type 1 and type 2. This is the novel classification of prodrug. This classification is based on how body convert the prodrug into active drug. In case of type 1, bioactivation of the drug occurs inside the cell. This is intracellularly. And in case of type 2, bioactivation of the cell occurs outside the cell. This is extracellularly, means extracellular compartment. This is systemic circulation or any other extracellular site. This is GIT fluid or other site. Then in type 1 and type 2 is subdivided into type 1A, 1B, and type 2A, 2B, and 2C on the basis of location and site of therapeutic action or bioactivation. In case of type 1, the bioactivation site is therapeutic site. The example as acyclovir, 5-fluorouracil, and etc. In case of type 1B, bioactivation of the occurs in metabolic site. This is lungs, liver, or GIT mucosa. And then example is carbamazepine. In case of type 2A, bioactivation of the product occurs in the GIT fluid, and the example is loperamide. And in case of type 2B, bioactivation of the cell occurs in the systemic circulation or others extracellular fluid compartment. The example is chloramphenicol. And in case of type 2C, bioactivation of the drug occurs in the target tissue. This is therapeutic site of drug action. The example is ADP ETH. Then what are the significance of prodrug? There are various significance. It modifies the pharmacokinetic process, also it modifies the pharmacodynamic process. In a pharmacokinetic process, it modifies the it increases the palatability of the drug. Thus, it reduces the poor acceptance of the drug. It increases absorption, increases distribution even in low lipid water partition coefficient, and thus it reduces the first hepatic metabolism. It also modifies the biotransformation of the drug. It also modifies the excretion of the drug, and it also modifies the pharmacodynamic process. It produces site specific drug action. That's why it reduces the adverse effect of the drug, and it also increases the duration of action of drugs. There are also some disadvantages of the prodrug. Sometimes it takes time to reach the peak plasma concentration. That's why it reduces the potency of the drug. Some important question comes in the written examination invariably. The question is rationalize the use of some products in therapeutics. The answer is, if we use levodopa as a prodrug, levodopa is a product that converts to dopamine. Dopamine cannot cross the blood-brain barrier. That's why cannot enter the central nervous system and cannot widely distribute in the central nervous system. In case of we use levodopa, can cross the blood-brain barrier, then it enters the central nervous system, then it converts to dopamine by DOPA decarboxylase enzyme. That's why we use levodopa in Parkinsonism. Another example is when you use enalapril is an prodrug. Enalapril reduce the problem of drug absorption. Enalapril is an active drug. That absorption of the drug occurs is very slow. About 10% of the enalapril is absorbed. When you use enalapril as a prodrug, the absorption of the drug is very much improved. About 60% of the drug is absorbed. That's why increase the bioavailability of the drug. That's why we use enalapril in case of enalapril as a prodrug. Thank you all for watching my today's lecture. Assalamu alaikum.